Funding for the production of Folks is provided in part by the Friends of LPB.
In cities throughout Louisiana, community centers provide a variety of services to the needy. Medical care, food stamp distribution, and social work counseling are just some of the programs available through the centers. Due to stringent economic measures, community centers may be closing their doors to their lower-income clients.
When it cuts back on our income, it makes it real rough on a lot of us because we don't have the money to pay our utility bills and things. And my income is $292.10 a month, and it takes all of that to pay my utility bills. And a lot of my medicine I have to do without.
Hello, everyone. I'm Rob Hinton.
And I'm Genevieve Stewart. There is a word that has filtered throughout all levels of government that has created a stir, not only here in Louisiana, but throughout the country. And that word is cutback.
Some people would say that the word cutback has become almost synonymous with government nowadays. Some of us can afford to take up the slack caused by government cutbacks, but what about the poor, the needy, and the elderly? How are they coping with budget cutbacks? We'll find out today on Folks.
Everybody says folks, just plain old folks. Everybody just people all over the world. Folks to live, folks got to give, folks got to care, ooh, folks got to share. Our world is small, so very small. What touches one of all, ooh, touches us all. To stay alive, just to survive, folks got to be in harmony. Everybody just folks, just plain old folks, just plain old folks. Everybody just folks, everybody just folks, just plain old folks, just plain old folks. Everybody just folks.
Cutback. To some people, cutback falls into the same category as some of those naughty four-letter words. Here in Louisiana, we have seen many people lose their jobs because of cutbacks. We have also seen many services curtailed, particularly social services. And although politicians might argue that cutbacks are necessary to bring the state's budget into line, some people say the cuts are hurting the people who need assistance the most. For example, the elderly. This is the Fairfields Senior Center in East Baton Rouge Parish. It is one of 3 senior centers operated by the parish's Council on Aging. Over the last 2 years, the number of workers employed by the Council on Aging has decreased from 108 to 68, a decrease attributed to budget cutbacks. One of the services hardest hit by the cutbacks has been the Homemaker Program, a program designed to help some senior citizens who would otherwise wind up in some institution remain in their homes with some outside assistance. But the number of workers employed by the Homemaker Program has decreased from 9 to 3, and now a long list of potential clients has gotten even longer. However, there are many services and activities still available for senior citizens at the center, like this exercise class. Cutback is a word that these people are all too familiar with, and one they would like to eliminate from the vocabulary of politicians.
When it cuts back on our income, it makes it real rough on a lot of us because we don't have the money to pay our utility bills and things. And my income is $292.10 a month, and it takes all of that to pay my utility bills. And a lot of my medicine I have to do without.
One vital service that is in limbo for people at this center for fiscal year '84 is health screening.
Right now, it's past the 15th of May, and we're still waiting to hear whether or not we'll have funding at all through DHHR for our health screening project. A great deal of that funding comes through city parish and through revenue sharing, but some of it comes through DHHR under the old Title 20 or the present block grant program. And some of the letters had gone out to some people, you know, and saying what they were going to get and what their allocations would be. At this point, it's only 6 weeks away from time for the program to renew a contract, and we've not been notified that they would not renew it, nor have we been notified of a funding level. So it's still pending and up in the air as to whether or not there will be funds for that program.
One thing LaFleur believes would help senior centers throughout the state provide better service is an equal distribution of the funds allocated to senior centers.
In the state, there's over $3 million set aside for senior center funding. The parishes, all 64 parishes in the state share in that $3 million. New Orleans has $1.3 million just for New Orleans. They have 88,000 people over 60. In East Baton Rouge Parish, we have 38,000 people over 60, which is about half, and yet we only have $100,000, and $100,000 compared to $1.3 million shows you what a wide disparity there is in it. So that we're trying to run 3 senior centers in East Baton Rouge Parish with just $100,000, and that's very hard. You have very little to do extracurricular things or to take them on things that would be preventive or enjoyable that they wouldn't get to do otherwise.
Rob, did they mention anything out there about nutrition programs for the elderly?
Well, Sharon LaFleur, who runs the Council on Aging here in East Baton Rouge Parish, said the only program that has remained intact since budget cutbacks have become in vogue has been the nutrition program.
Well, that's good to know, because that's always been a concern of mine. As you well know, Rob, senior citizens aren't the only ones feeling the pinch of state budget cuts. There are the truly needy and low-income families who look to social programs for assistance. One place these people also look to for help are community centers, and budget cutbacks have created hard times for community centers also. In cities throughout Louisiana, community centers provide a variety of services to the needy. Medical care, food stamp distribution, and social work counseling are just some of the programs available through the centers. Due to stringent economic measures, community centers may be closing their doors to their lower-income clients. Eden Park Community Center in Baton Rouge is one of 3 such centers operating here, with at least an equal number operational in New Orleans and Shreveport. In the face of harsh economic times for all, the question is, how will these community centers and the poor people they assist survive in the face of funding cutbacks? Mr. Hawkins, what type of funding cuts are community centers facing?
Well, right now we are faced in, let me say, first of all of our funding to operate this center comes from the state, Department of Health and Human Resources. And at this point, the department has recommended that all of our funding be suspended. In other words, we were expecting a cut, but we was not expecting to be deleted from the budget. Ms. George and I have been going to the legislature to let the legislature know how vital the services that we provide to the community are, and to try to get them to reinstate the funding for the center back into the budget. If we do not come up with some other source of funding, especially for the Eden Park Community Center, then we would have to close our doors effective July 1st. But we feel that we will be able to come up with some additional funding from someplace, because the services that we offer to the community is so vital. And I think that we can convince members of the legislature and also the governor's staff how vital these services are, and to encourage them that we should be reinstated back into the budget.
If the community centers are closed, where will the poor go for duplicate services?
Well, in our community, if this center is closed, then the poor will have no place to go, and that's our argument. This center is pretty much the heartbeat of this community. Before this center was developed here in the community, of course, that was nothing for the people, but I think now the people have gotten used to the center being here and bringing their problems to us, and we've been able to solve these problems. But if this center should close, then I would think that this whole community would start going downhill, because, like I said, the center is the heartbeat of the community. Pretty much everything that goes on in the community comes through this center. And we service probably about 30,000. There are 30,000 people that live within the catchment area here. And all those people will be adversely affected by these cuts. 85% of what we do is that of providing health care. Here at the center we offer, we have a pediatrics clinic, we have a general medicine clinic, we have a dental clinic, and of course we have OBGYN clinic. In addition to that, we have a food bank where we provide emergency food to those people who are in desperate need, and we also issue food stamps. We, I would say somewhere in the neighborhood of 14,000 people per month visit this center in some way or another. In addition to that, we also have a public library, which is a part of our operation here also.
I asked Mr. Hawkins how much money is needed to keep the community center operating, and the number of people it currently serves.
Okay, our total operating budget here, which we receive from the state government, is about $300,000. Now, what we do is that we generate a lot of our funds through Medicaid, Medicare payment, and some private pay. A person pay accordingly to what they make. It's a sliding fee scale. Certainly if a person is not working and doesn't have an income, then he doesn't pay for the medical services that we offer. But without having the state funds to operate, then that would not allow us to generate the other fees that would keep us going. Last year we generated somewhere in the neighborhood of $130,000, which was then put back into our operation budget to assist us in providing these services to the community.
To help us continue our discussion today on state budget cuts and the effect they are having on social programs, we have Annie Smart, an activist for welfare rights here in Louisiana, and Rod Banks, Assistant Secretary in charge of Family Security for the State Department of Health and Human Resources. Welcome to Folks.
I'm glad to be here.
Let me begin by asking a question to the both of you. Both of you work closely with low-income poor people. Would you say that poor people are worse off today than they were, let's say, 2 years ago?
They are.
I'd say that's a question of some are, some aren't. It's a selective thing. It has not been across the board. At least the programs that my office is involved with have not across the board reduced benefits. There have been changes in eligibility standards and changes in the particular circumstances of an individual. So some who have been affected are definitely worse off. Some are not very much worse off.
Maybe you could tell our viewing audience exactly what programs do fall under the spectrum of your office.
All right, what are called the income maintenance programs and the medical programs, specifically aid for families with dependent children, general assistance, the mandatory state supplementation of SSI, which is really very small, a refugee resettlement and Cuban Haitian entrant program, which is also very small, a low-income energy assistance, and the medical assistance, mostly Medicaid. There are some other portions of medical assistance. The total of those programs in the current bill before the legislature is some $772 million.
Annie, to back up to what we said before, you said poor people are worse off today than they were 2 years ago. Why do you say that?
The reason I say that because we've been getting reductions in AFDC, reduction in general assistance, reduction in food stamp recipient ever since '80. And with those, right now with general assistance, there has been a 16% reduction in services to those people. The cutback came at this point because of the fact that the president was supposed to do what you call a swap program. Swap program meant that the Medicaid, the federal government would take care of that, and the states would take care of AFDC and food stamp. But the swap is no longer there. So what happened now, the state is cutting back on the very people who need those services.
Well, let me ask you this. Are the people who are receiving AFDC and on food stamps, are those people really in need of those services?
They're in need of those services. And what has happened, what Mr. Banks hasn't talked about, is that we have three sets of poor. One is the needy, what the president talked about, the real needy. Then you have the other one who's unemployed, who lost employment since '80, that can't get employment because there's none there. Then you have the other class who is not at the 40,000 bracket, or is say from 30 back, who is not working but can't get any benefits because they had worked in the last months or so. So you have what you call this prior month situation where a person, even though he doesn't have any money, but because he worked in prior months, that means that he can't get any benefit. And this is what's been happening ever since '80 and '81, which means that the reduction in AFDC has been great, and the impact not only just because of budget cut, but because state reduced because they wasn't going to get the swap.
Let me ask you, Mr. Banks, we have heard in interviewing different people at different times, persons say that they have not been unemployed long enough to collect unemployment benefits.
they cannot qualify for welfare or food stamps. Let me ask you this. Does the state have a type of referral system where these people might go for some type of immediate emergency aid?
No, to my knowledge, that it does not. Unfortunately, the assistance programs in the state are keyed to children, families with dependent children, and to the aged. And the only programs available to people who are, we also have programs for people who are disabled. The only programs that provide assistance to people who are able-bodied and in, say, the 18 to 60 category are the unemployment insurance programs through the Department of Labor. There are no, quote, public welfare programs for people in those categories, with the exception of food stamps. It provides some assistance, not a great deal. I think a single unemployed, no income person with living by themselves is eligible for something in the order of about $90 a month in food stamps. Obviously, that's not, if they have no other income, that's not enough to live on. But that food stamps is the only program that addresses the problems of people between children and old age.
So what cutbacks have we seen in the services, food stamps, AFDC, let's say since '81?
Well, it may surprise you, but the answer is none. We have actually increased every program in my office to this point. Now, we are proposing, as of the 1st of July, significant reductions in the Medicaid program in the order of $46 million. But at this point, there has been, adding up all those programs and excluding food stamps, because that does not go through the state budget, and I really don't have the figures on it, but excluding food stamps, but including AFDC, general assistance, mandatory supplementation, refugee and Cuban and Haitian assistance, low-income energy assistance, and the medical program, we have had about a 5% increase in the last 2 years in the amount of money.
But haven't you changed the eligibility criteria for some of those and haven't that removed some of those people from those roles?
There are, within that, changes which would remove some people from the roles. Yes, there have been changes in eligibility requirements. I got curious when I was preparing for this program. I added up all the fiscal impacts of the rule changes since July 1st, 1981. And the impact of those rule changes was to increase the programs by nearly $30 million. Now, we have proposed rule changes, particularly in the medical assistance program, be effective the 1st of July, which would reduce benefits by some $48 million. So if the current budget before the legislature is based on those rule changes. So if that budget is enacted and the rule changes are approved, there will be about a 2% decrease over the last 2 years. Interestingly, if you look at the national picture, and in this case you include food stamps, the American Public Welfare Association recently did a study. That study indicates that over those programs in the last 4 years, but from fiscal year 1981 through the projections for 1984, there has been nearly an 18% increase in those programs. Now, what you have to understand is that the major portion of those increases come in the Medicaid program. They have nothing to do with the benefits that actually get to recipients. They have to do with inflationary increases that are built into the program. They go to increased payments to hospitals, doctors, nursing homes, and other providers. They don't change the services. So it's a little bit misleading to look at pure money. However, looking at the rule changes indicates that the net effect of the changes that have been made has been positive up to this point. It will be negative in the next fiscal year.
Well, to go with something that happened recently, about 3 months ago, that was a rule came out about the doctor visits to the nursing home for long take care of patients and that kind of thing. And when I called the nursing homes to find out what effect that would have on some of the people in those homes, I found out they had been doing it 2 years already. That the rule was just being sent out in order to make it authentic, that it was already being done, that some people could not see a doctor for 60 days already. So it means that they have already been cutting back. And I wouldn't sit here and tell you not. I work on the cases every day. And there has been cutback. We've been putting people back on, but they have been cut off because of monthly reporting, because of a lot of things that's happening that's not in the cutback, but in the policies that have been sent down by Washington. It's causing a great deal of problems and impact on the poor, the elderly, and everybody because of those policies that some people can't meet. If you don't know what the policies are, you still can't be eligible for those services. Some people don't understand that they have a right to a fair hearing. They don't know that they have a right to talk to their workers about any changes in their program to keep their benefit. So what I'm saying is, whereas maybe it wasn't an increase, but every time you lose people from the program because there is a deduction in services to those people because they weren't able to meet the criteria.
Ms. Smart, let me ask you this. It seems as though many people are complaining, saying that the poor are always pointing their finger at the government, all right? What is the private sector doing? What are people out there doing in terms of churches and organizations to assist the poor, to help fill that void that the government has left through cutbacks?
Well, you can get a lot of help from churches, but the churches is just like anything else. The federal government has pushed its responsibility on the state. What we're going to face is that the state's going to have to raise taxes, and that's what I'm afraid of. And who's going to pay them? Since a lot of unemployment, we have 43 states now has lost federal aid, and I don't know what's going to happen with those states. One thing, our state has the wrong priorities. They are cutting back at the expense of the poor, but they never cut back any of the administration. If you look at the administration, what they have done is, and what makes me very angry, is that they have taken and kept the administration as is, but they didn't do any more hiring. Nobody can apply now and get a job, but the people who's in the administration can take those jobs that are available that they're not hiring, which is a moratorium on hiring, but they're not saying it's a moratorium on hiring. You just can't get any job. So those jobs are saved for those people who are in the administration at the expense of poor getting cut on the programs.
Mr. Banks, with a change in criteria for eligibility, let's say for AFDC, let's say, how are the former people who receive those benefits coping with the loss of benefits?
Well, I have only a small amount of information on that. There was recently published, in fact, I got a copy 2 days ago, a study done by the Research Triangle Institute in North Carolina of the effects of the 1981 AFDC changes. Among those changes was a cap on the amount of income at, I believe it was 150% of the needs level. There was also a 4-month cap on income disregard, which is called 30 1/3 disregard. Those were designed to force people who had income off of AFDC. The Research Triangle study, which incidentally included 2 parishes in Louisiana among the sample, Rapides and Orleans, their study indicates that that effect was achieved, that people who had income and were employed and were also on AFDC tended to leave the AFDC program in greater numbers than people that were not employed, and that after 1981 they tended to leave in greater numbers than they did in 1980. They found that the major coping mechanism was to increase the amount they worked, continue with the working they were doing. There was something like 60% that they coped by some way of work, either continuing, getting a job, getting a second job, or something on that order.
When you said there are going to be cuts in fiscal year 84, are you talking about the AFDC and food stamp programs? And if so, how much are we talking about?
Primarily, we're talking about the medical assistance program, Medicaid. The proposed cuts that are not yet in the proposed changes that are not yet in effect would be a net of about $24,000 increase in AFDC. Now, we have a problem in AFDC in that the budget was estimated on the caseload last September and October. There's been a significant increase in the caseload. Unless that reverses and the caseload goes back down, we are going to face a problem of having insufficient money to continue benefits at the current level. The caseload in 1981, July, was about 68,000. It went down by July of 82 to about 62,000, and as of January, it was back up to 64, and it's been climbing. The last month's report indicates that it's again leveled off. So we hope that we're going to see it drop again and that we won't have the problem. But as of now, there would be a slight increase because of the rules. There is a decrease in the total amount of money because the caseload has gone down. General assistance, we are proposing a really drastic cut. We set out to reduce the administrative costs of the program. In doing that, we also turned out that we affected the benefits of the recipients. That is under consideration. It's been published as a proposed rule. At this point, I would not tell you that we're going to follow through, that the Secretary has to make a decision as to whether we really want to do that, given the testimony that we've had in public hearings. Refugee resettlement is a minor increase that's really no significant. Low-income energy assistance, as far as we can tell, will be at the same level as last year. That's a 100% funded federal program. It depends entirely on what the federal funding is. Medical assistance programs, we are proposing a nearly $47 million reduction. Majority of that, $10 million.
Mr. Banks, I hate to interrupt you, but our time has run out for today. I do want to thank you, Mr. Banks and Ms. Smart, for being with us. It's certainly been very informative. And next week on Folks, we'll close our spring season with a look at some very special people.
Special people indeed, Genevieve, the mentally retarded and the physically handicapped. We hope you'll join us then. Until that time, so long.
Funding for the production of Folks is provided in part by the Friends of LPB.